Hi everybody, Dr. Bryton here for 2-Tip Tuesday. Today we're going to be discussing stretches for your jaw joint or stretches for your jaw muscles. And our tip today will be how can you loosen, relax those muscles. So some people have a tendency to literally get a really tight jaw. We see patients that clench and grind and maybe don't wear a bite splint, and they really can get some tension in those muscles of the jaw and create some difficulty in their ability to actually open. And I mean that not just for eating, but also for talking. In addition to that, we have patients who maybe accidentally or had literally an event where they bit into something on accident, where it was too hard, too thick, and it literally kind of strained the muscles of the jaw. And so those are things that we want to try and release some of that muscle tension. And then finally, we have patients that maybe come in for their oral wellness visit, or they need to do a filling or something like that, and you're open obviously more than you would in a typical day, and as a result the muscles get fatigued. It makes it harder for you to open following that visit. Makes it harder for you to chew, maybe talk. And so I want to give you some tips on how to relieve some of that with strictly how can we stretch. So I'm going to kind of be zooming in back and forth here with a couple of close-ups of myself, and I'm sure at some point in time somebody's going to make a little mockery of this. That's okay, as long as it helps you. But my main stretches that I will give patients are as follows, and I'll kind of show you hand motions, and then from there I'll show you with my own jaw. First thing I'll recommend is a protrusion of the jaw. So if this is my lower jaw, here's my upper jaw. I'm going to actually have you protrude your jaw out. So it's going to literally kind of look like an English bulldog. And then from there, I'm going to have you protrude your jaw out, but then also go to the right and also go to the left. And in each one of these positions, I want to actually hold the jaw for about a 3 to 5 second hold. And then from there, we're going to progress the opening. So you kind of start with maybe a mild opening. I wouldn't say it's anything big at all, just kind of a mild opening. Some people cannot open that much when they're first kind of doing these sorts of things for reasons that the muscles are just too stressed out. So you just kind of go a mild opening, and you're going to protrude your jaw, hold for a 3-second count, and then from there, go to the right, go about a 3 to 5 second count, and then left, 3 to 5 second count. And then from there, I want you to actually open to about 25% of your maximum opening. You're going to do the same stretches. Protrude out, 3 seconds, then the right, then the left, 3 to 5 seconds on those. And then go from there to a 50%, then a 75%, and then max opening. And so in my own jaw, right? So kind of a side view here. You're going to start with a protrusion. Protrude to the right, protrude to the left, and that's just kind of a minimal opening through there. And then I progress to a quarter, half, 3/4, full. So it's kind of 25, half, 75, and all the way. And then from there, protruding it. So all the way would look like this. And that's actually really difficult to do. So if you feel funny doing it, yeah, it is funny to do. It is very difficult. And that's why I look funny doing it. And that's okay. But for those of you that have that muscle tightness, hopefully this can help you relieve some of that. But I will say, big thing with this is make sure that if you're supposed to be in a bite splint, get into a bite splint. It can help you out significantly with relieving that muscle tension. But if you have one of those accidents and you need some relief, that can help out significantly doing these stretches. If you've had an oral wellness visit or visit with me and your muscles are tight, do these stretches. It can relieve things greatly and make your functioning day much easier. If you're a lecturer, if you're a teacher, somebody who's going to be doing some public speaking, this is something you can do before that to help kind of relieve the jaw and relax the jaw, get it warmed up per se, so that you can go through those events properly. But I will say too, first thing in the morning before you even brush your teeth or eat, and same thing with a lunch or dinner, if you do it before that, it makes life a lot easier, just kind of relaxing, releasing, and warming up that jaw. So hopefully that tip is helpful for you. If you have any questions, as always, comment below. We'd love to answer you, or give us a phone call. Share this if you think you can help somebody. But we appreciate you tuning in. Feel free to like us. We love that. So have a great rest of your Tuesday. Have an awesome rest of your week. Thank you so much.